Right now, at this very moment, millions of seniors are sitting in chairs, lying in bed, or pacing the floor, not because they want to, but because a burning, shooting pain is stealing their freedom one step at a time. Medical research confirms that up to 40% of people will experience sciatic nerve pain in their lifetime, and the numbers climb even higher as we age. Studies show that nearly half of all adults over 65 report significant back and leg pain that limits their daily life. But here is what almost nobody is telling you. The relief you have been searching for may require nothing more than 5 minutes and the floor beneath your feet. Stay with me, because what you are about to learn changes everything. What you are about to see is not a trend or a quick internet tip. This protocol is assembled directly from peer-reviewed clinical research, guidelines from major medical institutions, and the evidence-based techniques used by licensed physiotherapists who specialize in treating seniors. Studies published in respected medical journals confirm that specific targeted movements, performed in the right sequence, can interrupt the pain cycle of sciatica at its biological source. Multiple clinical guidelines now agree. Staying still makes sciatica worse, but the right kind of movement creates real, measurable change inside the tissues surrounding your sciatic nerve. This 5-minute approach brings that science straight into your living room, and it works whether your pain has been going on for 2 weeks or 2 years. There are no tricks here, just biology, working in your favor. Let's talk about what is really happening inside your body right now. Your sciatic nerve is the longest, thickest nerve in the entire human body. It begins deep in your lower spine, right around the base of your back, and it travels through your buttock, down the back of your thigh, through your calf, and all the way into the sole of your foot. Think of it like a major electrical highway running the full length of your leg. When everything is working perfectly, signals travel smoothly from your spine to your foot and back again. You feel nothing unusual. Movement is effortless. But when something presses on that nerve, even just a little, the result can feel like a lightning bolt, a burning iron, or a deep, relentless ache that simply will not quit. Now here is what changes after 60. When you were younger, sciatica was most often caused by a herniated disc, a cushion between two vertebrae that slipped out of place and pressed directly on the nerve root. But research published in peer-reviewed medical journals shows that in people over 60, the picture changes significantly. The spine naturally narrows over time through a process called spinal stenosis. The small cushions between your vertebrae lose water content and compress like dried-out sponges. Your facet joints, which link each vertebra to the next, can develop arthritic changes that further crowd the nerve, and a deep muscle called the piriformis, sitting right next to your sciatic nerve in the hip region, can tighten and grip that nerve like a fist squeezing a garden hose. Picture your sciatic nerve exactly as that garden hose carrying water. When someone steps on the hose, the flow stops. The pressure builds. That is sciatica. That is precisely what you feel. And here is the cruel irony that traps so many seniors in a cycle of unrelenting pain. Most people instinctively rest. They lie down, they stop moving, they avoid anything that might make the pain flare. It feels like the logical, protective thing to do. But according to Mayo Clinic guidelines and multiple evidence-based clinical reviews, prolonged inactivity is one of the worst responses to sciatica. Staying still allows the muscles surrounding the nerve to tighten further. It reduces the blood flow that carries oxygen and healing nutrients to the inflamed tissue. It allows inflammation to settle in deeper and spread wider. The pain becomes the reason for stillness, and the stillness becomes the reason the pain never truly leaves. That cycle ends today. Before we go any further, I want you to hit that subscribe button right now. Join our growing family of seniors who are choosing to take their health back, one step at a time. Drop a comment below and tell us what country you are watching from. We have viewers joining from all over the world, and that community is part of what makes this channel so extraordinary. Now, Let's get into exactly what you came here for. Here is the truth that separates the people who beat sciatica from the people who suffer with it for years. Most of the generic advice out there tells you to stretch your hamstrings. You lie on your back and pull your leg toward your chest, or you reach toward your toes, and you get a few minutes of relief before the burning returns. And while those movements are not harmful, they address only one tiny piece of a much larger puzzle. Research from physiotherapy clinical trials confirms that the most effective approach for seniors specifically involves a sequenced protocol that accomplishes 5 things in a deliberate, purposeful order. It removes compression from the nerve first. Then it creates physical space in the spinal structures surrounding it. Then it mobilizes the nerve itself so it stops sticking to the tissue around it. Then it releases the piriformis muscle that so often grips the nerve from outside the spine entirely. And finally, it activates the deep core muscles that protect the nerve from future flare-ups. Each of these 5 actions corresponds to a specific biological mechanism. Each one builds directly on the last. Skip one, and the results are cut in half. Do all 5 in sequence, and you are working with your body's own healing intelligence instead of against it. Now here is the key thing to understand about why this works at a cellular level. When your sciatic nerve is compressed or irritated, your brain interprets those disrupted signals as pain, burning, tingling, or numbness that can run from your lower back all the way down to your toes. But here is the vital truth. Your nerve is not broken. It is not permanently damaged in most cases. It is stuck, squeezed, or inflamed, and all 3 of those conditions are reversible. Research published in peer-reviewed physiotherapy journals shows that gentle, targeted movement increases blood circulation directly to the nerve, delivers natural anti-inflammatory compounds to the irritated tissue, and physically frees the nerve from the structures compressing it. Think of it like a kinked garden hose. You do not need to replace the hose. You simply need to unkink it. That is precisely what this 5-stage protocol does. And here is something that makes this approach especially powerful for seniors. Every single movement in this sequence can be modified if getting on the floor feels difficult. Every step has an accessible alternative. You will not need expensive equipment, no gym membership, no prescription, and no risky procedures. Millions of people, many of them well past 60, have used these exact evidence-based movements to go from barely walking to moving freely again. A retired schoolteacher named Margaret, 67 years old, described her sciatica as feeling like someone was pressing a hot coal into her lower back every time she stood from her chair. After consistently applying this kind of sequenced protocol for 3 weeks, she reported being able to walk her grandchildren to school for the first time in over a year. That is the kind of transformation we are talking about. Let's build it for you right now, 1 stage at a time. Stage 1 is called the nerve decompression position, and it produces relief faster than almost anything else in this entire protocol. Here is exactly what you do. Find a sturdy chair, a couch edge, or even a coffee table. Lie down on your back on a comfortable surface, your bed or the floor with a yoga mat, and place both feet up on that chair so your knees are bent and elevated above the level of your stomach. Your body should form a gentle Z shape from your hip to your knee to your ankle. Let your arms rest comfortably at your sides. Take a slow, full breath in and let it out completely. Now here is what is happening at the biological level during this position. When you stand or sit throughout the day, the weight of your entire upper body compresses the lumbar vertebrae, the bones of your lower spine, directly downward with force. Research from clinical spine studies confirms that this compression dramatically increases pressure on the discs and nerve roots in the lower spine, which are already narrowed and partially dehydrated in most people over 60. By elevating your legs to this specific angle, you effectively remove the gravitational load from your lumbar spine. The compression pressing on those nerve roots drops dramatically. The inflamed tissue surrounding the nerve root begins to receive blood flow again, and pain signals begin to quiet down. Think of this like releasing a clamp from a water pipe. The moment the clamp loosens, water flows again freely. The moment your spine decompresses, nerve signals begin to normalize. Many people report a noticeable reduction in the burning sensation down their leg within the first 2 to 3 minutes of holding this position. Stay here for 5 to 10 minutes when your pain is at its worst. Mornings are often ideal. You can gently flex and point your ankles while you rest here to further improve blood circulation through your lower legs and feet. A 63-year-old former firefighter named Robert described his morning sciatica as so severe he could not put on his socks without sitting down and wincing through the pain. He spent 10 minutes in this decompression position every single morning and within 2 weeks reported that the first hour of his day had completely transformed. Stage 2 is the spinal space opener, and this is where the real structural work begins. This movement targets a process that clinicians call lumbar flexion, gently bending the lower spine in a forward direction, which is specifically designed to open the narrowed spaces between your vertebrae where your nerve roots exit the spine. Here is how to perform it. Sit on the edge of a firm chair with your feet placed a little wider than shoulder width apart. Place your hands on your thighs, just above your knees. Now slowly slide your hands down your legs, allowing your upper body to bend forward through your hips and lower back. Go only as far as feels comfortable. You are absolutely not trying to reach the floor. When you reach your comfortable limit, hold that position for 5 full seconds while taking one slow, deep breath in and all the way out. Then gently slide your hands back up your thighs and return to upright. Repeat this movement 10 times in total. Here is the science behind why this works so powerfully for seniors specifically. Multiple clinical studies confirm that in adults over 60, the most common cause of sciatica shifts significantly from disc herniation to spinal stenosis, a narrowing of the vertebral canal and the small exit tunnels called foramina. When you flex your spine forward in this slow, controlled way, you physically increase the diameter of those narrowed canals. It is like widening a bottleneck on a congested highway. The traffic, your nerve signals, suddenly has more room to flow. Physiotherapy researchers use the term centralization to describe the positive response you may notice as this works correctly. The pain that was shooting down to your foot begins to migrate back upward toward your lower back. That migration is a positive sign. It tells you the nerve root is being freed from its compression. If you feel this happening, keep going. If pain moves further down the leg instead, simply slow down and be gentler with the bend. Stage 3 is called nerve gliding, and this is the step that most generic stretching advice completely misses, and it may be the most important movement in this entire sequence. Physical therapists who treat thousands of patients with sciatica consistently point to nerve gliding, sometimes called nerve flossing, as one of the single most effective techniques for resolving sciatic pain at its neurological source. Here is the key insight that makes this so powerful. Your sciatic nerve is not just lying passively inside your leg like a cable in a wall. It moves, it slides, it glides through the surrounding tissue every single time you bend, extend, or rotate your leg. That is normal and essential. But when the nerve becomes inflamed or compressed, it stops gliding smoothly. It sticks. It catches against surrounding tissue like a thread snagging on rough fabric. And every single time it catches, it fires a pain signal upward to your brain. Nerve gliding frees that thread. Here is how to do it. Lie on your back with both knees bent and your feet flat on the surface beneath you. Take the leg on your painful side and gently draw the knee up toward your chest, holding your hands loosely behind the knee for support. From this position, slowly straighten your knee, extending your leg upward until you feel a gentle pull or a mild tingling sensation down the back of your leg. Hold for just 2 seconds. Then slowly bend the knee back in toward your chest. That is 1 full repetition. Begin with 5 slow, controlled repetitions, and over the following days gradually build toward 10. Never push into sharp or shooting pain. You are looking for a gentle stretch sensation, something that feels like a satisfying pull, not a sharp jolt. Clinical research examining nerve mobilization therapy confirms that this technique reduces neural tension, improves the nerve's natural conductance, and significantly decreases both pain levels and functional disability in people with sciatic symptoms. Think of it exactly like flossing your teeth. Each gentle back and forth motion clears the surrounding tissue and restores the nerve's natural, free-flowing movement through your leg. Stage 4 addresses something that almost nobody discusses in generic sciatica videos, and it may be the single biggest reason your pain keeps cycling back no matter what you try. Deep inside your hip, lying just millimeters away from your sciatic nerve, lives a small but powerfully influential muscle called the piriformis. Its primary job is to help rotate your leg outward during walking and turning movements. But when it becomes tight, inflamed, or caught in a low-grade spasm, which happens with remarkable frequency in older adults due to prolonged sitting, reduced hip mobility, and weakening glute muscles, it can press directly against the sciatic nerve running right beside it. This condition is called piriformis syndrome, and clinical literature confirms it accounts for a meaningful percentage of sciatica cases that get mislabeled as purely disc-related or spinal in origin. This is specifically what creates that deep, aching throb right in the center of your buttock that then radiates down the back of your thigh and leg. Here is how to release it. Lie on your back with both knees bent and your feet flat. Now take the ankle of your painful leg and place it across the top of your opposite knee so your legs form a figure 4 shape. From this position, gently press the bent knee, the one pointing outward, away from your body using the muscles of your hip. Do not pull or force the movement with your hands. Simply allow gravity and your hip muscles to ease the leg open. You should feel a deep, satisfying stretch right in the center of your buttock where that piriformis muscle lives. Hold this gentle press for 5 seconds, then release completely. Repeat 10 to 15 times. If lying down is difficult, do a seated version instead. Sit in a firm chair, cross your ankle over the opposite knee, and gently lean your chest forward at the hip until you feel that same buttock stretch. The Cleveland Clinic and multiple physiotherapy evidence reviews confirm that piriformis-specific release exercises reduce compression on the sciatic nerve from this outside source. This is the step that fills the gap. This is what so many people have been missing. Stage 5 is called core ignition, and this is where you lock in and protect everything you have just built. Think about it this way. The previous 4 stages work to decompress the nerve, open the spinal spaces, free the nerve from sticky tissue, and release the deep hip muscle gripping it. But without strengthening the deep core muscles that hold your entire spine in proper, supported alignment, all of that compression will gradually return. Picture your spine as a suspension bridge. The roadway, your vertebral column, only stays level and stable because of the tension cables supporting it from both sides. Those cables are your deep core and lumbar muscles. When they weaken, and peer-reviewed research confirms they do weaken progressively with age, the whole structure sags and begins to compress the structures it was designed to protect. Here is how to activate those muscles without straining your back. Lie on your back with your knees bent and your feet flat on the floor. Place your hands gently on your lower abdomen. Now draw your belly button slowly down toward the floor, not sucking your stomach in dramatically, but subtly flattening your lower back against the surface beneath you so there is no space or arch between your back and the floor. Hold this gentle engagement for 5 full seconds while continuing to breathe normally, then release completely. Repeat this movement 10 times. Once this feels manageable and comfortable, add a gentle bridge. From the same starting position, Keep your core muscles engaged, squeeze your glutes, and slowly lift your hips just a few inches off the floor, not higher than a straight line from your knees to your shoulders. Hold for 5 seconds, then lower slowly and with control. Aim for 5 to 10 repetitions. This movement activates the precise deep stabilizer muscles that clinical research identifies as critically important for reducing both the severity and the recurrence of sciatic pain. A 71-year-old retired nurse named Dorothy had struggled with chronic sciatica for 3 full years. After consistently practicing this core activation sequence, she reported within 6 weeks that her pain episodes had dropped by more than half in both how often they happened and how severe they felt. That is the power of building the right foundation. Now, before you begin, there are some critically important things you need to understand for your own safety. Everything in this video is for educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Please consult your doctor or a licensed healthcare provider before beginning any new movement program, particularly if you have existing spine conditions, a history of recent surgery, or any active injury. There are specific warning signs that require immediate emergency medical attention. If you experience sudden numbness in your groin or inner thighs, a sudden loss of control of your bladder or bowel, or rapidly worsening weakness in both legs at the same time, please stop and seek emergency care immediately. These symptoms can indicate a rare but serious condition called cauda equina syndrome, which requires urgent medical intervention. Do not attempt any of these movements if those symptoms are present. This protocol is not appropriate if you have a recent vertebral fracture, a diagnosed spinal tumor, or an active infection near the spine. If you have had back surgery within the last 6 to 12 weeks, always obtain explicit clearance from your surgeon before attempting any movement program whatsoever. If you have been diagnosed with severe osteoporosis, speak with your physician before performing the lumbar flexion stage, because forward bending of the spine can carry an increased risk of compression fracture in significantly weakened bone. These precautions are not meant to alarm you. They are meant to keep you safe. For most seniors with typical sciatica, this protocol is gentle, safe, and highly accessible. But individual circumstances always matter, and your healthcare provider knows your specific history. As you perform these exercises, a mild dull ache or a gentle pulling sensation is completely normal. Your body is responding to movement it has not experienced in a while. But any sharp shooting increase in pain radiating further down your leg is a signal to stop that specific movement, ease back, and reassess. If that response persists after you modify the movement, speak with a physical therapist or your physician before continuing. Here is exactly how to put this 5-stage protocol into practice starting today. The complete sequence takes approximately 5 minutes at a comfortable, unhurried pace. Begin with stage 1, the decompression position, and simply rest there for 2 to 3 minutes while your spine unloads and your breathing slows. Move into stage 2, the seated forward bend, and complete your 10 slow repetitions with a 5-second hold at the bottom of each. Transition to stage 3, the nerve glides, beginning with just 5 gentle repetitions and never pushing past the sensation of a good stretch. Move to stage 4, the piriformis figure 4 release, and complete 10 to 15 repetitions on your affected side, holding each press for 5 seconds. Finish with stage 5, the core ignition, performing 10 pelvic tilts followed by 5 to 10 gentle bridge holds. Perform this sequence once in the morning and once in the evening for your first 2 weeks. Morning sessions address the stiffness and nerve compression that accumulates overnight as you sleep. Evening sessions reinforce the neurological reset before your body enters its overnight repair and recovery cycle. After 2 weeks of consistent daily practice, most people find they can comfortably reduce to once per day as maintenance. What should you realistically expect in terms of a timeline? Most people notice some reduction in the sharp shooting quality of their pain within the first 3 to 5 days of consistent practice. The burning and tingling sensations in the leg tend to follow next, typically improving somewhere between the first and second week. Full functional improvement, the kind where you are walking longer distances, sleeping through the night, and waking up without that familiar morning jolt of pain, tends to develop over 3 to 6 weeks of daily dedication. That is not a miracle timeline. That is simply how long inflamed nerve tissue needs to calm down and how long supporting muscles need to build genuine, functional strength. Track your pain on a simple 1 to 10 scale before and after each session. Write it down in a small notebook. Most people are genuinely surprised when they look back at their notes after 2 weeks. Progress feels invisible day to day, but the numbers always tell the truth. Here is what we know with certainty. Your sciatic nerve is not your enemy. It is simply a magnificent, intricate system under temporary stress. And with the right 5 minutes, applied consistently and with patience, you can give your body exactly what it needs to begin healing from the inside out. Every stage in this protocol is rooted in clinical research. Every movement has helped real seniors, people carrying the same pain you carry right now, reclaim the freedom to walk, to garden, to play with grandchildren, and to move through their days without bracing themselves for the next wave of fire down their leg. That freedom is not out of reach. It is 5 minutes away. Thanks for watching.